Hi, I'm Kristin, and I'm a certified Lamaze childbirth educator. This is a free online series of childbirth education classes based on the Lamaze Healthy Birth Practices. You'll get the most value by watching all the classes in the series in order, and you can visit my channel for the full playlist. If you find these video classes helpful, please like the video and subscribe to this channel, and consider donating via PayPal using the link in the description. If you'd like to take group childbirth classes in person with me, there's also a link in the description that shows you how to sign up. As always, keep in mind that the content in these classes does not constitute medical advice. Let's get started.
Thank you for joining me for Class 5 in Childbirth Education for Your Best Birth. If you have not watched the previous classes, 1 through 4, please go back and check those out now. You'll get the most value from this video series if you watch the classes in order from 1 through now 5, and you watch them to completion. So please check them out. We're going to recap from class number 4 that you get to make the decisions. We talked a little bit about the acronym BRAIN, and BRAIN gives you the power and knowledge to make decisions for your baby's birth. You're going to be asked throughout your labor about various procedures and things that you would like to have done. And the more you know ahead of time, the more you understand what those terms mean, the more empowered you are to make the right decisions for you and your baby. So in the acronym BRAIN, B stands for benefits. What are the benefits of a procedure? R stands for risks. What are the risks of a procedure? A is alternatives. This is where you ask, what are the alternatives to this procedure that you're asking me about? I is intuition. What does the mother and her partner, what do the mother and partner feel is the right thing for their baby? And then N stands for nothing. And that means, what if we do nothing? A lot of birth is about just simply waiting. And sometimes rather than rushing things with a new procedure, sometimes you just need to give baby time to move down and to be born on its own. So a recap from class 3. Let's help your baby down the birth canal starting during the 3rd trimester. And one of the most important things you can do is to avoid reclining for long periods of time. Do not watch TV, do not hang out with friends in a reclining position. This can make it more difficult for baby to move down. So as we learned in class 3, at 32 weeks or later, you'll notice that baby's head will turn at some point, and it will be most likely facing down. So to help your baby down, you want to make sure that you don't recline when you're resting. You want to sit upright or lie on your left side. And why your left side? Because that is where that's the position where your body will be able to have the best circulation so that you're sending nutrients to your baby. Make sure you rock and sway on a birth ball every day. We've talked about that in a previous class, and I shared some techniques on the birth ball. Get your steps in. Walk every day. Health recommendations these days are to get in 10,000 steps a day. You don't have to necessarily get 10,000 steps, but aim high. Try to get as many steps in a day as you can. A lot of us work office jobs and we're sitting down for many hours a day, and that can make it really difficult for baby to move down because baby relies on the natural movement of us walking and moving around all day long. And when we're sedentary in an office chair all day, baby doesn't have those opportunities. So make an effort to get up and walk around for at least 5 minutes every hour. And do the glute scoot. I shared the glute scoot with you. It's a wonderful workout, whether or not you're pregnant, but it's also a great way to help baby to get that swaying motion in and to be able to rotate in the right position for birth. Recap from class 4, we talked about early breastfeeding. You want to make sure that you try to breastfeed within the first hour. Your baby will be more alert and awake, and it will be getting to know you. It will be very calm. It will be fixing its eyes on you. Babies can't see very clearly that at that young age, but they still are memorizing your features. So while you're having that quiet time, make sure you offer the breast. You want that baby to have exposure to colostrum. be persistent and consistent. So even if your baby falls asleep or your baby struggles to latch on, it's still so important that you keep trying. And a lot of labor and delivery nurses and midwives are trained to help you with that very early latch on. So please ask for help and make sure that you surround yourself with family members and friends who respect your wishes and your desire to breastfeed. Spend a lot of time doing skin-to-skin contact. And this isn't just for the mother, this is also for the father. Baby knows mother and father based on scent because their eyes aren't really able to focus very well at that young age. So they really rely on scent, and they right away memorize mother's scent and father's scent. So make sure both of, or the partner, whoever the birthing partner is, make sure that that baby has skin-to-skin contact with both. Refrain from giving your baby a pacifier for the first week or so. This is so that baby can develop a really good breastfeeding relationship with you. We want baby to get as much colostrum as possible. We want baby to encourage the breasts to produce milk in the first 3 to 5 days. So make sure you have a very strong breastfeeding relationship there. Practice, and try to avoid the pacifier for at least that first week so that baby knows what the most important thing for them to suck on is. Keep putting baby to breast even if it falls asleep. You may have to wake baby up, and you can do this by gently flicking a finger on baby's foot to wake it up. And just keep doing this. You want baby to get as much colostrum those first few days as possible. If you have any questions or any difficulties, please do not give up. Please keep trying. I know that early breastfeeding can be tough when you're a first-time mom. It really is worth it. And when you surround yourself with people who respect your wishes and want to support you in your breastfeeding relationship with your baby, they will help you too. So talk to your labor and delivery nurse, talk to a lactation consultant. They're wonderful resources, and they will be able to help you have that really strong, healthy breastfeeding relationship. Your colostrum is the only thing your baby really needs those first few days because your baby's stomach is so tiny when it's first born. So it really can only handle just that small amount of colostrum that's coming out of your breasts. So there's not a need to formula feed at that time. Just let baby take as much colostrum as possible. And each day, baby's tummy gets just a little bit bigger. And that prepares it for when your milk comes in at 3 to 4 days roughly, that your baby's stomach will then be big enough to be able to handle this new milk supply that's coming in. You don't need to give supplemental formula feedings unless your pediatrician recommends it. Babies, like I said, the babies' tummies are so small that it can be absolutely overwhelming if you're giving them a bottle of formula that is a much greater quantity than their stomach is meant to handle. So stick with colostrum unless your care provider, your pediatrician, your medical professional tells you that you need to formula feed. So, what might your newborn look like? Sometimes they can come out looking a little different than you expected. So, some of us have heard about quote unquote cone head babies. This can happen if baby spends quite a bit of time with its head in the birth canal, and this causes head molding. Now, just remember that babies' heads are very pliable, and they will come back to their normal shape within a couple of weeks or so. So just be patient. Baby may look a little bit funky in the early days, but that is okay. This is something that nature created. Baby has plates in its head that are very flexible. They're connected with tissue that's like your tendons, like the cartilage in your nose. And so that cartilage allows those plates to shape and form when they're going down through the birth canal. And then, of course, as baby gets older, those plates close up, and then you don't have that same cartilage in between them. Vernix, or cheesiness. Oh my goodness. the vernix on a baby serves a wonderful purpose, and sometimes they are really coated in it. If you have a baby that's born at, say, 38, 39 weeks, it may be really covered in a lot of vernix. And vernix is there almost like nature's lotion that protects baby's skin when it's in utero, when it's floating in this ocean of amniotic fluid. It keeps baby's skin very soft and supple. And it's recommended that you not remove the vernix because it is such a wonderful substance, and it may even help baby to regulate its own body temperature after it comes out of the womb. So the more you leave that vernix on, the more good it does for your baby. Swollen testicles and also swollen breasts. Because mom has so many hormones going on through her body throughout pregnancy, baby gets those hormones too. And so baby boys, they're getting a lot of estrogen and progesterone, and this can cause their testicles to be very swollen when they're born. The same thing for baby girls. Their vulvas can be very swollen. Also, both little baby boys and baby girls can both have swollen breasts, and that's just simply from the mother's hormones that are sent to the baby's body during pregnancy. Obviously, after a couple of weeks or so, those hormones work their way out of the baby's system, and the swollen parts go back to what you might expect. And of course, as always, if you have any concerns, if you have any questions, please talk to your care provider, talk to your baby's pediatrician, and ask about these different things if you have any concerns or questions. Kind of like the head molding, baby may come out with molded features, as you see here in the middle bottom picture. This is actually one of my babies, and baby came out with a squishy little nose. So obviously there was quite a bit of squeezing going on there in the birth canal, and baby's head was probably not quite rotated the way we ideally wanted it to be, and so therefore the little nose got squishy. So it took about 2 weeks for that nose to straighten out and look like we expected it to. Lanugo, that is hair on the body. And this is also another protective thing from baby being in utero. That lanugo helps baby, it protects the skin while it's floating in that sea of amniotic fluid. And baby will come out. It may be well covered with hair. It can look like you have a little werewolf baby sometimes, and that is perfectly normal. That hair will fall out over the coming weeks, and it's something that you don't really need to worry about. So, but as I mentioned earlier, if you have questions about any of these things or you have any concerns whatsoever, please do talk to your baby's doctor and see, learn more about it. And I think that you'll find that it's an interesting sort of thing to see these things on your baby and to discover that they're temporary. Some other things that you may see is milia, which milia may show up after birth. And these are just tiny white little dots that you may see on baby's face. It could be on the nose, it could be on the forehead, it could be elsewhere in the face. They're just harmless tiny cysts. As I mentioned earlier, baby's body is exposed to so many hormones from the mother while it's in utero. And these hormones kind of throw things out of whack for the baby those first couple of weeks. And baby's system needs to move those adult hormones out. And what that often does is it can cause various, little skin things. You'll see down below milia, you'll see baby acne. That's also very, very common. And baby acne is kind of like when a teenager is going through puberty and they're exposed to so many of these new hormones their body has never really had to manage before, and it can cause acne problems. And it's very similar in babies. These are things like milia and baby acne. You do not have to scrub them off. You do not need to use special soaps. You can just let them be and just clean your baby normally with a gentle washcloth and water, no soap on the face, and your baby will outgrow this stage. Another one that's similar to that is cradle cap. You'll see that in the lower bottom. And cradle cap is kind of it's not a very pleasant looking thing. It's pretty much just baby dandruff. And this is also the baby's body trying to process all of these new hormones that are coursing through its body, and this new exposure to the outside world. Its skin is being exposed to this new environment, and so it can put this, create this kind of crustiness on the baby's head. And again, you do not have to peel it off. You don't have to scrub it off. You don't have to use soap on it. This is something that could last a little while. It can vary from baby to baby, whether it's a few weeks or longer, but it's something that will go away. And if you have any questions, please do ask your baby's pediatrician or medical professional. Stork bites, as you see in the upper middle, those are temporary birthmarks that you may see on a baby. And sometimes they're even on a baby's forehead. I've seen many new babies with little pink streaks on their foreheads, and those are also stork bites. Those will fade in, it could be weeks or just, a few months. It doesn't take very long. They are totally normal. And again, if you have questions, please talk to your baby's doctor. Mongolian spots on the upper right side, those are typically found on babies that have more melanin in their skin, so darker complected babies. They will sometimes have these bluish spots on their on their backs, buttocks, and lower bodies, and they may last a little while. They could take a few months to fade, but they usually do fade, and they are completely harmless. If you have any questions, please talk to your baby's doctor about them. And something you will see your baby do all the time is the rooting reflex. Babies just naturally, if something brushes their cheek, your hand could brush their cheek, your breast could brush their cheek, anything could brush the baby's cheek, and it will immediately go into rooting mode, and it will be looking for a breast to latch onto. So newborn care and soothing. So we're going to talk a little bit in just a moment about diaper changes. And if you have never changed a baby's diaper, I'll show you some tips and tricks that will be helpful. And also bathing and cleaning baby. It's really not necessary to bathe your baby those first at least couple of weeks. If baby does get a little bit dirty, usually what you do is you focus on the folds, the areas that might get kind of crusty or messy, or if milk drips down, you just use a very soft washcloth that you put under warm water, squeeze it out, and you just wipe those areas clean. You don't really want to expose baby to a bathtub full of water when it's very young, just simply because it's still learning to regulate its body temperature, and being in water and then coming out can lower its body temperature very quickly. It can be quite a shock for baby's body. So try to limit those first few weeks of cleaning up baby to just a nice, soft, warm washcloth that you use to wipe those areas that might get kind of dirty. And swaddling. I'll show you some swaddling tips. Some babies love swaddling, other babies not so much. So you'll have to try it with your baby and see if it works well for you. The side hold. This is a wonderful hold that I'll demonstrate for you that can really help to soothe baby. And it also involves the birth ball as well, which I guess is also an exercise ball after you have your baby. And shushing. This is a wonderful trick to use to help calm your baby. I've used it on a variety of babies, and I think it's pretty much always worked. It does help tremendously, and I've got a little trick for that too. And bouncing. This is where the exercise ball comes in. You will probably spend a lot of time bouncing on a ball with your very young baby. And that's because baby is used to, when it's in utero, it's moving around a lot with mom. And it misses that. That was very soothing to it. And so you'll be practicing a lot of that with baby, where you're holding baby, maybe swaddled in a side hold on a birth ball to help soothe baby and get it to sleep.
If you were taught how to change a baby's diaper, you probably learned this technique, lifting the baby's butt up into the air. But there's a better way to do this that doesn't put pressure on baby's head and neck. First, place baby on a surface that's easily washable, like a blanket or a towel or a cloth diaper. Then have a wipe ready, so when you open the diaper, you place the wipe over the baby's private parts just in case the cold air makes it pee. Then roll baby over onto its side and fold up the diaper and set it aside. Grab a clean wipe and wipe the baby from front to back. You always want to do that, especially on little girls, because you don't want germs from their bottom to get into their vaginas. If baby needs to be cleaned up, I'm a big advocate of wiping baby down rather than giving it a bath, especially in the little ones 6 months or younger. Because baths can really lower their body temperatures, and lots of times little babies don't like bath time, and so it can be a pretty miserable experience for both parent and baby. First, wipe baby down in the folds of its neck, both front and back. This is where sweat and dried breast milk can collect. And turn baby on its side when you need to wipe down the back of the neck. Then wipe the folds of the armpits. You'll use these same techniques if you decide to put baby in a bathtub. To give baby a bath, you'll want to fill a baby bathtub with just a few inches of warm water and test the water with the inside of your arm. Make sure that the water feels the same temperature as the inside of your arm. Never leave baby unattended in the bathtub, and work quickly, wiping all of these areas, because you don't want baby's body temperature to get too low. Before you give baby a bath, make sure you put down 2 towels. I like to put towels in the dryer first to get them nice and warm, and then lay them out so that they're ready for baby before I even start the bath. Once baby is out of the bathtub, immediately place it on top of the towels. These hooded towels are great because they can keep baby from losing a lot of body temperature through its head. Wrap baby quickly with both towels. There are a lot of different swaddling products out there now that make it really easy to swaddle a baby, but I'm going to show you the old-fashioned way. You grab a baby blanket and you fold down one corner into a triangle. Place baby on top with its shoulders at the line of the blanket and tuck baby's arms in. Wrap it firmly in the blanket on one side. Bring that side of the blanket around and tuck it under the baby. Bring up the bottom and hold it firmly. Then bring around the other side and wrap baby firmly. You can also leave one or both arms of the baby out in case you have a baby that really doesn't like to have its whole body swaddled. So baby is fussy. Now what do? This is where the exercise ball comes in. Bouncing baby on the exercise ball resembles the sensation that baby feels when it's in the womb, so it can be very comforting. But let's say baby continues fussing. So try the side hold, where you hold baby on its side and continue bouncing. If that doesn't work, try the other side. Sometimes baby will prefer one side over the other. And always be sure to hold baby with both hands firmly when you're bouncing on the ball. You can also try holding baby upright in a sitting position. But your baby might still be fussy. So here's my secret weapon, the baby shusher. There are a variety of different brands out there. Mine is a Frida baby and it's rechargeable. I think the sound is very spooky, but babies love it. I've even had a small child fall asleep listening to it. Keep it near baby, but not next to its head. And most babies find this very soothing.
So let's talk about postpartum bleeding and what you're going to experience during the time of lochia. So lochia is the bleeding that you have after you give birth. It is not like period blood. It's different. And so that's why it's important to talk about what you're going to experience. And I love these diagrams from Cleveland Clinic because they really help explain what you're going to see in those first few weeks. So the first week, you're going to have dark or bright red blood, and it's going to really cover a lot of your maternity pad that you're wearing. It can last for 3 to 4 days. It may feel like a heavy period. It is very different kind of blood and tissue. It is normal to have small clots, and you may notice those whenever you go to the bathroom. You may see, small little clots in the toilet or on your toilet paper after you wipe. And you may have some period-like cramping. And of course, as I mentioned in a previous class, each time you put baby to the breast, you will be releasing hormones that will then go down to your uterus and help to shrink it down a little bit faster. So this is another great value to breastfeeding, is that it's helping your uterus to return back to its original shape, and it's also squeezing out more of that lochia. So you'll feel that cramping, and it can be uncomfortable. If your medical provider okays you to use something like ibuprofen or Tylenol, check with them, ask if it's okay. That can often help with that cramping pain in the early, those first few days. So I want to make an important point here that in those first few days of lochia, if you experience a clot that is the size of a golf ball or larger, please call your care provider immediately and let them know. Small bits of clotting is totally normal, but those large clots could be cause for concern, and you need to let your labor and delivery department or your OB or midwife know of any kind of clot that you pass that is, let's say, a golf ball size or larger. In the second week of postpartum bleeding, you can see that it's lighter. It's going to cover less of your maternity pad, and it will be more pinkish brownish. It's going to be more watery. It may last 4 days to maybe up to 2 weeks. It's moderate. It's pretty manageable. You may have very few clots or no clots. So in the final stages of lochia, postpartum bleeding, you'll see that it is very light. It's kind of yellowish brownish. It can be a little bit creamy white, or it can be kind of clearish. You'll see little to no blood whatsoever. It'll be more like spotting towards the end of a normal period, and it can last as long as up to 6 weeks past your baby's birthday. So the day your baby is born, you may still experience some of this later spotting as much as 6 weeks after baby is born. You will not have any clots, and it is definitely more manageable, and you will probably be able to use much smaller pads. So how to take care of yourself during the postpartum bleeding stage. In the early days, your lochia may get heavier during physical activity. If you're walking around a lot, if you're exercising, and like I mentioned, if you're breastfeeding, each time baby latches onto the breast, it's going to send hormones down to your uterus. It's going to tighten your uterus into contractions, bringing that uterus back down to its normal size, and that's going to cause more lochia to be squeezed out. And of course, when you get out of bed in the morning, you've been lying flat all night, and then you get up, and all of that blood that may have settled there is going to go somewhere as soon as you go upright and gravity kicks in. Do not use tampons or menstrual cramps while you're experiencing lochia after birth. You don't want to insert anything into the vagina whatsoever. You want to make sure that for 6 weeks after baby is born, don't insert anything into the vagina, because it can introduce bacteria and germs and cause a host of problems. So no sex, no tampons, no menstrual cups anything like that in the vagina. Be sure to call your care provider if your lochia does not smell right. It's going to have a very earthy, musky smell to it. It's not going to be offensive in any way, normal lochia. However, if you take a quick sniff of your lochia and it doesn't smell right, you know right away something isn't right, or it's not the right color, please let your care provider know immediately. If you're soaking more than 1 pad per hour in the early stages of lochia, please let your care provider know. As I mentioned before, if you have golf ball sized clots or larger, please let your care provider know immediately. If you feel cramping after, let's say, day 4 or 5, let your care provider know, just so that they can get an idea if there might be something going on. As I mentioned, you will have some cramping as your uterus returns to size, to its normal size, and your baby nurses, which kicks off that process. You'll have some cramping then. But let's say after day 4 or 5, if you're still having cramping, please talk to your care provider and find out if it's anything to be concerned about. And of course, if you experience any lightheadedness after you have your baby, please do talk to your care provider. If you develop a fever, you get sick, or you experience swelling in your vaginal area after you give birth, let your care provider know immediately. So I'm going to talk some about the importance of postpartum rest. Here in the United States, we really don't value postpartum rest, but a lot of other countries in the world do. It's very typical in a wide variety of countries, everywhere from Morocco to China, and there's several, Mexico, there's several in between, that they focus on a minimum of 30 days of postpartum rest for each new mother. Some of them go up to 40 days. In China, it's called confinement. And this is where the mother does not get out of her pajamas. In most cases, she spends very little time outside of bed. She has food prepared for her. All of the housework is done by someone else. And all she does for those 30 to 40 days is simply focus on her baby. So she feeds her baby, she nurses her baby, and she eats, she sleeps, she takes care of her own body. And that is all she does during that time. And that allows, as I mentioned early on, that allows this dinner plate sized wound from the placenta that's inside the uterus to heal. It also helps the uterus return to its normal size a little bit faster. And the mother is also less apt to develop postpartum depression and other mental health challenges if she has that quiet time to really focus on bonding with her baby and not having to manage everything else in the real world at the same time. So as I mentioned, in India, Brazil, China, Morocco, a lot of other countries, the mother stays home for those at least 30 days, and oftentimes, I believe it's 40 or 41 days, and her only job is to take care of her own body and to feed her baby. These traditions help to bond the mother and baby, and they reduce the chance of postpartum depression. So in the United States, we're really not a society that is tuned into allowing a mother to take that much time off, unfortunately. And it can harm a mother's relationship with her brand new baby. So there are ways that you can try to work within the system to get that postpartum rest that you really need to heal, to recover from birth, and to bond with baby. You can hire a postpartum doula to help care for your baby while you rest. You can work with a lactation consultant as soon as you have any problems with breastfeeding at all. Any questions, any issues, any pain in your breasts, anything where it seems like baby's just not latching on effectively or not getting enough in the nursing process, please reach out to a lactation consultant. You can talk to your midwife, your care provider, and ask who is a lactation consultant that you trust, and get that referral from them. Be sure to ask family and friends when they visit to bring something to help you. They should not come over and expect to be entertained by you, and they should not expect that you wake the baby up so that they can see the baby and hold the baby and feed the baby. Friends and family that come over should be expected to carry their own weight, and they can do that by bringing you nourishing, healthy foods. They can also come over and they can wash dishes for you. They can do laundry. They can fold laundry, put it away. They can clean up the kitchen or the bathroom. They can help you with various tasks, taking care of animals you may have in the family, taking care of other children you may have in the family. Make sure that the people you invite over in those first 30 days have a job to do when they come over other than just simply be entertained by you and your baby. They should be carrying their weight and doing something to help you because you've done something wonderful for them by bringing this wonderful family member into the world. Limit your visitors for at least 30 days. Make sure that only the people you truly care about and love and who support your decisions as a new parent, those are the people who should be coming over and seeing you after baby is born. Don't invite the people who are more judgmental, who may ask tough questions that you're not ready to answer yet, who may nag you about things that you don't want to think about, who may bring up things that stress you out. Don't have those people come over. Tell them that your care provider or your doula has recommended that you limit the people who come to visit you, and you are waiting at least 30 days to invite other people over. Postpartum mental health is an issue that is very near and dear to my heart, and that is because I have struggled with postpartum depression in the past after the birth of one of my children, and it was a very, very difficult and dark part of my life. As happy as I was to have this little baby in my arms, it was very hard to find my way out of postpartum depression. So I want to provide as many resources as I possibly can, and if you find that you are feeling the things that I'm about to talk about here, I want you to seriously look at the resources, take advantage of them, reach out to people that care about you, reach out to professionals, these resources I've mentioned, or I will mention, and do what you need to do to feel better so that you can fully bond with your baby and you can be happy. So there is something called the baby blues, and this is perfectly normal. Those first 2 weeks after baby is born, you may experience a certain level of just feeling very emotional. You may cry at times, you may feel sad, you may feel overwhelmed, you may feel very sleep deprived, and that is completely normal. Having a baby, those last days of pregnancy, you may not have slept much. During labor, you probably didn't sleep much and get much rest. If you had your baby in the hospital, you may not have slept very well in a hospital bed. I can tell you I'm someone who doesn't sleep well in hospital beds. It is extremely normal to feel those baby blues. Just be aware, notice. You can tell your partner or your loved ones, I think I'm experiencing some baby blues, and you can ask them for help just with that adjustment. But I also want to distinguish the baby blues from postpartum depression or anxiety. So like I mentioned, it's very common to feel sadness for the first 2 weeks after baby arrives. So the best thing you can do is ask for help and get lots and lots of rest. Postpartum or depression lasts longer than 2 weeks. So if your baby is more than 2 weeks old and you're still feeling symptoms that I'm going to show you, then talk to your care provider, talk to your midwife, talk to your OB or your labor and delivery nurse, talk to a mental health professional and share what you're feeling. If you have excessive crying, if you feel like you're struggling to bond with your baby, there is nothing wrong with you. You are not faulty in any way. You are not a bad mother. It is perfectly normal for a mother to struggle to bond with a new baby. If you have insomnia or you find that you're sleeping a lot, way more than you ever expected, you feel like you can't even get out of bed, you feel like you just can't really function out in the world, please reach out for help. If you withdraw from friends and family, if you say that you don't want to see people, if you say you don't want to reach out to people even though you're having these strong feelings, it's so important that you not ignore that. If you have intense irritability or anger, maybe you feel angry at your baby, maybe you feel angry at your partner, maybe you're angry at the world, maybe you had a difficult birth and you feel angry in general that you didn't have the birth experience you expected. That is all very normal, very understandable, and it does not make you faulty in any way. If you feel like you're not a good mother, if you feel like you're not figuring it out, it's not coming to you intuitively, or you're not bonding effectively with your baby, it is okay. Lots of mothers feel like that the first weeks or even months of pregnancy. And if you're having those intense feelings, please reach out to loved ones, people you trust, your medical professional, and also mental health professionals if you have access to those. And I will provide you with some resources in a moment. If you feel very spacey, if your mind is cloudy, if you feel like you just can't focus on things, or you feel like you just can't make decisions anymore when you really have to, it is okay. You may be experiencing depression or anxiety, and it's all right. There is help out there for you, and it will not last forever. If you feel hopeless, if you feel like these difficult things that you're going through, whether it's breastfeeding challenges or recovering from a cesarean section, or if you've been feeling sore because of the birth, or maybe you're having trouble dealing with family members who are imposing themselves on you, or maybe your baby cries a lot, maybe your baby is what they call colicky, you just have a fussy baby, you may feel hopeless, like this is going to last forever. I want you to make note of that, acknowledge it, and it is okay if you're having those feelings. Please do not delay help for postpartum depression or anxiety. The longer you wait, the worse you can possibly feel, and the harder it is to come back from that. So please take action sooner rather than later. As soon as you think you may have postpartum depression or anxiety, please talk to your care provider. You can work with a therapist that specializes in postpartum care. I am located in Sacramento, California, and there is a wonderful therapy practice close to Sacramento called Dancy Perinatal Counseling, and all they do is specialize in providing counseling to families that are dealing with infertility, pregnancy loss, the loss of a child, birth trauma, postpartum depression, whatever issues can arise out of the challenges of getting pregnant and having a baby and then having a newborn. Dancy Perinatal has wonderful resources and extremely well-trained and experienced therapists that you can work with. They can meet with you in person if you're here locally in the Northern California area, but they also offer online appointments. So please, please reach out to them. You can text them, you can call them, visit their website, see what kind of services they can offer you. They can help you find a way through postpartum depression and anxiety. You can also find some wonderful resources online at Postpartum Support International. This is an amazing nonprofit organization that can help you find mental health care in your local area and find ways of coping. It also can help your loved ones to support you during this process. You can also call the National Maternal Mental Health Hotline. This is an amazing resource where they have people on the hotline who are there to answer 24 hours a day, to support you, to answer your questions, to help you find the resources that you need to feel better. You can always text the Crisis Lifeline at 988. Whenever you're having any kind of mental health crisis whatsoever, please text them. They are wonderful, wonderful people. They are so supportive, and they will follow up with you. They will check in with you. They will communicate with you via text. They will call you if you give them permission. It is a wonderful resource, and I highly recommend it to anyone who's having any kind of mental health challenges. You can also work with your loved ones to develop a plan for managing your intense feelings at mysafetyplan.org. This website has wonderful resources for taking a look at what it's like to go through a mental health crisis, to feel deeply depressed, and what you can do and what your loved ones can do to help support you so that it does not become a bigger problem for you. And please always know that you are not alone. So many of us have dealt with just deep, sad postpartum depression and anxiety. And you are always loved. There are always people in this world who love you and will absolutely support you. And if you reach out to these professionals that I'm providing here, they will help you to get the care that you need, and they will help you to communicate with your loved ones so that they can be supportive of you too. So that was a very deep ending to our class today. So I'm going to bring us out of that. Let's take a look at our next class. What are we going to talk about? So now we're going to get into the nitty-gritty of what it's like to live with a newborn and to get back into real life. So we'll look at some options for you to protect your job while you're taking time off after your baby is born. We know that it's so important to be able to get that postpartum rest. You deserve it. You deserve to have time off. It's often very difficult for a lot of people. They may not be able to afford it. They may feel that their jobs are not safe. I'm going to examine those difficult issues in our next class. I'm also going to offer some resources, some ideas for returning to work after baby arrives. You are protected by laws that support you to pump breast milk. You're also supported by laws, federal laws and sometimes state laws that can protect your job so that if you need to take time off, say baby gets sick, you'll be able to do that. I'll talk some about breast pumps and, like I mentioned, your federally protected rights to pump breast milk at work. And also, how do you find reliable and safe childcare for your brand new baby? And also, what social services are you eligible for? There are a lot of things out there to support brand new families, but not everyone is aware of those things. So I'm going to provide some resources, some leads, so that you can find the resources that work well for you to support you on this new journey. Because your journey has just begun when your baby is born. You've got this wonderful little being in your life, and it's a lot of responsibility, but there are people and resources out there that will support you. So once again, thank you for joining me for this class. I always enjoy hearing from you. If you have comments, please leave them in the comments section below. And if you enjoyed this class or any of the other classes before it, please give a thumbs up. Like the video and recommend it to a friend. I want these to go out there into the world, these classes to be available for as many families as possible, because we really need this support. It's very challenging in the United States to have a happy, healthy birth and then to raise a child and be a happy, healthy family. And I want to help you get the best start you can get. So subscribe to this channel for more videos. I'm going to try very hard to continue to make great classes for you. There's an endless supply of content out there, of information, of wonderful things to talk about to help your family at this time. So I'm going to try to bring those to you as often as I can. You can also, if you're able to, you can donate to this channel by using the link in the description below. So once again, thank you and have a beautiful day, and I will see you in the next class.
If you're located in the Sacramento, California area, you can also take classes with me in person. Watch this tutorial to find out how you can register.
To sign up for classes, visit southgaterecandpark.net and visit the Recreation menu. Click on Register for Programs, then scroll down on the next page and click on the Register Now button. Go up to the Activities menu in the upper left-hand corner and click on Special Interest Classes. You'll see Childbirth Education pop up at the top. Click View Sub-Activities to see the available classes, and then click on an individual class to read the description, the dates, and the times.
And when you're ready to sign up, click Create an Account in the upper right-hand corner, enter your email address, and then follow the prompts to register.
I look forward to seeing you back here at this channel, or in person if you decide to take classes with me. Watch the video series so that you too can have the best birth for your family. Have a beautiful day.